recording. Hello,
Okay.
Fatima. Welcome.
Hi, how are you?
I'm good, thanks. Um, so it took us a while to get this going. I think it took like a week or something
Yeah,
because
I feel like we're both so busy. It's quite hard to reschedule
yeah,
and stuff like that.
we wanted to do Wednesday, but you had what did you have on Monday? What did they do?
I had this procedure called an endoscopy,
Okay.
where they put you to sleep. And obviously, I've been suffering from abdominal pain, severe abdominal pain, really, for the past 1.5 years now. And I've been under investigation for that for the past 1.5 years, and it's been really difficult for them to actually figure out what's going wrong in my
If you
body.
can call it investigation. Because they just
So
keep
this,
sending you to because like I know you personally and
yeah,
it annoys me all the time that um whenever you go and they make some kind of test, you just come back and they're like, oh, we didn't really know what it is, but you just keep
yeah,
going to those tests.
yeah. I feel like I've done so many tests, and every single time I did a test, it'd come back and they'd say, "Oh, there's nothing that's showing in the test to say that there's anything wrong with you." And it was always quite disheartening every single time I went, because it felt like I'm not lying, but they can't see anything as well. So what is the missing gap in the middle, where if I'm not lying and it's not in my head and I know it's not in my head, why can't they see anything? Why isn't my body showing something going wrong when physically I can feel it?
Yeah.
And I think that was a constant battle in my head. I talked to my husband about it a lot, and I'd get very upset every time my doctor was going to ring me with results. I'd feel very excited but very anxious, because I knew either it's going to be something wrong which they can sort out, or it's going to be nothing, and then I'm back to square one again. And a lot of the times, although it was a good thing that there was nothing wrong, it was always disheartening knowing that there was nothing wrong that they can't fix, because until they find something that's wrong, they can't help me. So
Is it
this last
like
test,
is it like that they say you nothing is wrong, but you know that something is wrong,
yeah. So I keep thinking
but
to
you don't know
myself
what?
that, yeah, so I keep thinking, am I lying? Like, is it really all in my head and I've just made this whole pain up, and there's really nothing wrong, because I had an MRI scan, CT scans, cameras down, 3, 4 cameras down, and blood test after blood test, and nothing. Every single time it was nothing, until very recently they started to see things, which was a
After
big
how long?
breakthrough for me.
How long
After
it
a
was
very
it?
long time, 1.5 years.
1.5 years until they actually found something now
Yeah. I
that is
remember when
wrong.
this pain started, yeah, and I was in severe pain. I used to wake up in the middle of the night crying, because I didn't know what this new pain was. I was already going through treatment and for TB,
So
and
was
then
it
whilst I
was it
was,
like after you started treatment?
yeah, so it was halfway through my treatment that this
Okay.
stomach ache started. So I still had to carry on with my TB medication whilst dealing with the stomach ache. So I didn't know what to exactly do. So this test was supposed to be the final test, fingers crossed, to figure out what's actually going wrong. And we might be onto a breakthrough. Hopefully, they've taken some biopsies, and we're hoping for some results, really, to figure out what's wrong and how to treat it now.
At last. But like
Yes.
how do you deal with that fact that um you know something is wrong, you feel something is wrong. Also you said that you might even like question whether you're lying to them, whether you know that you're not lying, but how you deal with that like uncertainty that you know something is wrong and it's not something like minor, it's pretty serious.
Mhm.
How do you deal with
Oh
that
yeah,
like when you don't know?
I feel like it was a lot of. If I was on my own, I think I'd struggle a lot, because when I was living at uni and I had this pain, I did struggle quite a bit. As you know, like, you were there when we did uni together, and it was very difficult doing my degree whilst being in this pain. I missed a lot of uni, and
You were really
I
good at hiding that pain though.
yeah. um
So like
I
what
felt
is it
like it
that
was
you
very
like you don't
hard.
want others to see that you're in a pain, or like what's the reason why you wouldn't show it? Because like many times when I would offer you let's say when we went to the Tesco and I said if I can help you with bags, and you were like, no, 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 I'm good. And I can see that you don't have a lot of energy, but you wouldn't allow to help. So like, why is it, I don't know, is it hard to show that you are in a pain? And if it is, like, what is the hard part about it?
It was hard to show that I was in pain because I felt like no one actually knew the kind of pain I was going through. So I felt like trying to describe this pain was impossible for someone that was not going through the pain to understand it. For example, if someone's had a paper cut, you know what the paper cut feels like. So if I tell you I've had a paper cut, you can understand what kind of pain that is. But when I tell you I'm suffering from multidrug-resistant tuberculosis and I've got abdominal pain now from the medication or whatsoever, there's no way you can understand that because you've not been through it. And that's
Yeah.
not your fault, that's not anyone else's fault. But I struggled, and you eventually start to feel like a burden for the people around you because you're going through something and you don't want to be the person that ruins everyone else's mood because you're not well. So I feel like I had two personalities. I had one personality where I was a uni student, I was socializing with my friends as much as I could, going out to see them, going for food. And then there was a person when I'd get into my room and I'd have like a big box of medication and like I'd be on my own with my condition where I could actually feel like me. Where if I didn't feel like getting out of bed, I didn't. But when I was with my friends, I had a whole new personality where no one actually knew the severity of my condition because I never showed it enough. And I feel guilty for doing that because I should have given my condition more importance. And I've realized that now. But when I was going through it, I just felt like maybe these people don't really need to know. It's a bit of a morbid situation to be in, and then you don't want to spread the negativity, and that's what I think I struggled with. And I'd struggled to see how much I was going through. Like I felt like because it was a day-to-day thing for me, I kind of just adjusted and adapted my life around it. I didn't feel like I had a massive change, and I should have let myself feel that, but I didn't at the time.
Yeah, well, even if you say that you felt like you would be a burden for me, like I knew, well, as much as you told me, because when you were in hospital, I just thought that you have nothing serious. I would just text you like I think there was that one lecture that you said you don't feel well, so you went to hospital. And after that, I didn't meet you. But every once in a while, I would text you, ask you how you are. You're like, oh, I'm good. I'm in hospital and things like
Yeah.
that. And I'm like, you didn't say anything more. And I'm like, okay, probably like nothing serious. Then a few weeks later, I would be like, how are you? Oh, yeah, I'm still in hospital. And I would feel like it's nothing important, but you were like fighting for your
Yeah.
life, being in isolation. But it's like, even the fact that when, like what you said about feeling like a burden, for me it was more like inspirational to see that you go through all that and at no point did you complain, or you jumped in like victim mentality about like, oh, I missed like one semester of uni, or I don't know, all the pain. At no point did you complain about it. You
Mm.
were like more towards like hiding it. And what you said about that people don't understand where you how it is to have it.
Mhm.
Now if you would describe somebody how it is, how would you describe it?
The TB medication, taking all of that,
just
or
just having
the
TB,
pain?
how it is to live with TB.
Okay, so to be honest, my symptoms started in first year of university. So I just moved away from home. I moved to Liverpool, and I was excited to finally
Which
start
first
this
or
whole.
second year?
It was first year. At the end of first year, I was diagnosed.
Okay.
Yeah. So all my symptoms started in first year. But I didn't give enough notice to them. I
Okay.
thought I had a really bad cough, and I always didn't think that this cough was anything serious. And then we finished our exams and everything, and then I went home, and I was sweating at night so badly that I used to have to get up in the middle of the night, change my clothes, wait for my mattress, duvet, and everything to dry up because I was drenched in my own sweat. And then I'd go back to bed and change my pajamas and everything. And it took me a while to realize that, okay, something's wrong. My parents started to worry and they were like, okay, we need to take you to a doctor. Something's wrong. And I feel like symptoms like that I should have picked up on earlier. And the coughing was honestly horrendous. Like I felt like I was a smoker, genuinely. Like it was a really horrible cough. And I was very weak. I lost so many kgs. I think I lost like 9 kgs. And I didn't realize that in me still. until obviously I went to the hospital, and it was difficult because doctors couldn't see the TB either for a while. So I
But
was constantly, again,
what was the reason for the weight loss?
TB, if you want TB, one of the symptoms of TB is having weight loss. So
Okay.
tuberculosis, you lose weight, you have hot sweats, you lose your appetite, stuff like that. So I was losing like a lot of weight, but
How
I didn't
long did it
notice
take for
any.
them to, you said it took them a while to actually notice that you have a TB. How long did
Yeah.
it take for them to actually diagnose it?
It took me a while to actually bring myself to go to a doctor. So I think it took me a couple of months to even go to a doctor to start off with. And then
Why
it
is
took
that?
at least like, because I didn't think there was anything wrong with me.
Yeah.
I thought there's
We
something,
all
if I
do.
can,
I think that's what we all have. Is that many times when you
yeah,
have some symptoms, you're like, I'm okay, like nothing is wrong with me, you know? Or maybe we
yeah,
want to believe that. Or maybe we don't want to
mhm,
know what actually is going on. So we're like, I'm fine,
yeah.
I will get better, which sometimes
I
we
think
don't.
one of the biggest lessons, I've learned is to listen to your body, because I wish I listened to my body earlier. I would have been treated earlier, but I didn't. I ignored what my body was screaming at me. I just silenced it instead. Um, so eventually I think it took like 3 or 4 months for the doctors to actually see that, because I had very, very, very high temperatures.
Hmm.
And I think that was the first like red light for them, and they obviously took me to the hospital and they diagnosed it with tuberculosis. Now, tuberculosis is obviously it was a kind of, it wasn't as like it's not as popular as we hear cancer and stuff like that. So at the time I didn't really know what tuberculosis was.
Let's say well
um
known.
yeah,
We don't have
I
that
didn't
popular.
know. I didn't know what anything was at the time, and I wish I did, because I wish there was more around what tuberculosis is. So, as you know, tuberculosis is obviously a bacterial infection that's spread through droplets in the air, and if an infectious person coughs it, you could breathe it in and eventually catch it. So I was told that I had tuberculosis. I had to isolate at home for 2 weeks, which is fine, and they give you all your medication, and
So
it's a 6 month
that is when they
course.
diagnose you with the tuberculosis, not the multidrug-resistant.
Yeah. So
So
at the
with that
start they
one, you just
didn't
sit
know.
down, sit home like 2 weeks.
Yeah. So I just had to stay
Okay.
at home for 2 weeks, and basically the idea is that once you're diagnosed with TB, the first 2 weeks you're infectious, and then once you've taken medication for the first 2 weeks of the 6 month course, you're not infectious anymore, so
Okay.
you're okay to be around people. So after 2 weeks, I kind of came back to uni, I remember, and we started second year at that time, and I was in the middle of a lecture. I think I was sat next to you actually
Yeah.
when I
I
received a
remember that
call from
lecture.
one of my nurses. Yeah, so I remember receiving a call from the nurses, and they said, oh, you need to pack a bag and you need to come back home and come straight to the hospital. And I still didn't know what was going on, and I
How is
realized when
it
I got there
receiving
that
that call? If they tell you just like, oh, pack and come to hospital, how is it receiving that call?
I personally thought it'd be like 3-4 days that they'd want to keep me in. So I kind of didn't pack very well. I should have, but I packed
Yeah.
like 3-4 pairs of
You didn't
pajamas
know.
because, yeah, because I didn't know what was wrong with me. They don't let you know over the phone. They wait until you come in.
Oh,
And
okay.
so I went back home. My parents took me to the hospital, and it was just a case of a consultant sitting me down, telling me, okay, you have multidrug-resistant tuberculosis. Now, in none of that conversation did he tell me exactly what multidrug-resistant tuberculosis was. And
Okay.
I was so scared that I didn't ask at the time, and I wish I did, but I didn't feel like he was interested enough to tell me anyway. So they put a mask on me and they took me to a negative pressure room, where basically I was isolated,
Okay.
and
What
I
is a
ended up
negative
staying.
pressure room?
A negative pressure room is that the air that you breathe and everything, it doesn't leave it leaves through a vent. So there's no air going into the hospital
Okay.
hallways, there's no air leaving the windows outside, you're not allowed to open anything. You're in your own separate space basically, and the air, there's a vent upstairs in the ceiling, and it just goes through there and gets out. Um, and I ended up staying in isolation for 50 days,
Okay.
which was difficult because I didn't know how to.
That was the
I was
time when
used to.
if I would ask you how you are, you would tell me, "Oh, I'm still in the hospital." Yeah.
Yeah.
And you wouldn't tell me
And
anything about being in isolation,
yeah.
having multi-drug-resistant TB, nothing about it.
I
I'm
think
just
that
still
was
in
that
hospital,
yeah, I
just
think that
fighting
was
for
the
my life.
whole I didn't want to not brag in a sense, but I didn't want anyone to think it wasn't even a case of, oh, I didn't want to show my weakness. I didn't see how bad it was anyway. I didn't understand how bad multidrug-resistant tuberculosis was because no one told me what it was. So I know I spent the first night trying to
Would you wish
remember.
you knew how bad it was? Do you think it would have affected you anyway if you knew how bad it was?
I wish I knew like how bad it was and like what the like what can go wrong with it, or how you can be treated for it and what the survival rate is, stuff like that. I wish I was known, because my doctor could have told me in a comforting way that, okay, you're going to get better, but these are things. Like when I had this test, they said, oh, you could have a tear inside your body and you might need a blood transfusion and stuff like that, but they still reassure you that that's very rare to happen, you'll still be okay. you know but with this whole thing, I remember my doctor just told me, oh, it's just multidrug-resistant tuberculosis. You're going to have to stay in hospital. Now my treatment went from 6 months to 24 months, and the medication changed. And it was a case of remembering at night when I was on my own, my first night, I remember trying to remember in my head what my doctor said. So I know he said tuberculosis, but I couldn't remember the words multi-drug resistant because I'd never heard of it before and there was no mention of it after that. So I remember trying to Google, types the tuberculosis, and then the one that ring the bell in my head was, oh, that's what he said, multi-drug resistant tuberculosis. And then I started to research and then noticed myself that,
But
okay,
were
this
you
is
doing this while
serious.
you were in isolation?
Yes, because I was on my own, I had nothing else to do. I spent a lot of time researching my own condition and what was happening inside my body. And I feel like I may have not mentioned what multi-drug resistant tuberculosis is. It's basically, so the TB that I was diagnosed with in the first 2 weeks is a course of medication for 6 months. And multi-drug resistant tuberculosis means that the medication that you take for TB for the 6 months, there's two of the medications which are called isoniazid and rifampicin, which basically your body is resistant to, so they don't have an effect on your body. So when I was taking them for the first 2 weeks, they made no difference to my body. My body was just resistant towards it. So the next course of medication for multi-drug resistant tuberculosis is a lot more toxic and has a lot more side effects. I remember side effects such as like my skin went red, I was sweating pink, my tears were pink, my nails went pink. My pigmentation was horrendous. I lost a lot of weight. I was struggling with my hair loss and stuff like that. Things that you don't realize. By one of the medications, and I now have peripheral neuropathy, so I can't feel my feet, my toes anymore because of the medication and stuff like that. And I didn't realize all this was happening because no one told me. So I spent a lot of time in isolation just researching.
But so with the feet, how did it that how did that happen? Because I remember that we were in lecture and you said that you can't feel your feet.
Yeah, so it starts off as one of the medications, basically, it's called Nezlid. Um, it has a side effect where you start to get like a burning sensation in your feet. So it's like a constant pins and needles, but it's burning and it's constantly there, and you can't wear your shoes. I remember I got to a point where I couldn't wear my own shoes. So I used to walk to the hospital and I used to have to walk in like sandals or slippers because my feet just wouldn't fit into my shoes anymore. It was just so painful. And
So it's not
the
because of the
doctors,
size of the feet, it's because of the pain you feel when you
yeah,
wear
yeah.
shoes. Okay.
Even if I was just lying in bed, the pain would be intense. Like I just couldn't live with my own feet. It was just constant like burning and poking inside my feet. But as soon as the doctors realized, they stopped the medication that I was taking for that, and it was okay. It was safe enough to stop that medication. And I eventually went through a few tests and we figured that there was nerve damage. So the nerves in the end of my toes have basically died because of the medication. So although I have feeling in my foot, I have no feeling in my toes. So the only downside to that really is now that when I got my toenails, it's quite hard to know how deep to go in. But at the start, I used to trip over my own feet a lot because I wasn't used to
Oh,
it. But now I've just gotten used to the whole thing, so it's not that bad.
and with the medication, I don't know if you remember the number, but how many pills did you take in all the time you I think you wrote
I
somewhere that
actually
it
don't
was
remember.
594 days of oral medication. So it's like it's
Yes,
almost two
actually.
years of
Yeah.
taking medication
I'm
every
not,
single day. It wasn't like one or two pills. It was like how many a day?
there was like 9 or 10 boxes. And I used to, because there was so many, I used to have a pill organizer for the whole week where I just, every Sunday was my routine to pop the pills in. So then I remember AM, lunchtime, breakfast, and, dinner time and what to take, because there was no way I could remember so much. But as well as the oral medication, I did have IV medication. So it was a PICC line basically inserted. It goes from the inside of your arm and it goes all the way and it sits on the top of your chest, this line. And 3 times a week for 8 months, I used to go to the hospital, and get an IV medication. That was one of the medications as well that I had to take. So not only was it oral medication, it was taking the medication through an IV line, which was a lot time consuming for a uni student, really trying
So how
to,
long you had to go 3 times a week?
for 8 months.
8 months.
Yeah.
So
So every Monday, Wednesday, Friday was my routine to basically go to the hospital.
while still studying full time, 2 semesters
Yes,
in one.
whilst I was doing 2 semesters together.
So
Yeah.
how do you manage to get that done? Because
I
like
was very
you said you
determined.
didn't have a lot of energy as well. So it's not just like, let's say me, I'm healthy. I don't have like, I don't feel tired most of the time. Well, sometimes I do. I'm still human. But it's like most of the time I I don't feel that tired. So I can get like uni work done or whatever done work that I needed to get done at the time. But it's different when you feel you have less energy just because you're pretty much fighting for your life. And then you have to go to hospital 3 times a day, and then on top of that you also do uni. So how do you get that done?
um, I didn't want my condition to determine the person I'd become, because I always had in my head that one day, whether it's 594 days later or more than that later, one day I'm going to make sure I'm cured from this. I'm going to make sure I take my medication every day. I'm going to make sure I never miss a dose. I'm going to make sure I go for my IV therapies. I'm going to make sure I do everything to get better, change my diet, eat better, whatever I had to do to get better. But then at the end of it, oh yeah, I'll be treated. But then what else do I have? Because I have a life to live once my medication is finished. I can't let my treatment and my condition shape the person I'm going to be once it's finished. Because once it's done, I'm just going to be left with being, oh, a TB survivor, which is a great thing. But I also wanted a career, and I wanted to do something with my life that didn't determine. I didn't want my condition to determine the person I'd be for the rest of my life. And although I've made decisions now to basically use my condition as such a strong, it influenced me so much that now I'm working in the field of tuberculosis. I'm doing a master's degree in tuberculosis and international public health to basically eventually have a career surrounding TB and helping people with tuberculosis. I didn't want my condition to stop me from graduating and finishing my undergraduate degree, because then I wouldn't have anything. And I needed something to keep me busy, because I knew that if I didn't, I probably would have gone into a very dark hole very quickly. And it would be really easy for me to go into that hole. But I decided that I'd fight against that and do my uni, really.
So how is that? I think we had this conversation last week as well about the identity, because having life-threatening disease, it does affect the way you identify yourself. Because like I remember I asked you if you remember the Fatima before TB. It's like you don't
I don't know
remember.
who she is.
It's like how does maybe how has having multi-drug-resistant TB has affected maybe your identity or the way you see yourself?
I feel like I see myself as a stronger person, because I felt like I didn't have a very strong identity before my condition, and I feel like my condition has shaped a lot of my choices now. I take chances, I take opportunities by the hand now, when before I would be very reluctant to. I used to hate doing presentations in uni. I used to hate public speaking. I would never do things like that. But I know that once I got diagnosed and I was asked to do a lot of speeches and talks and in front of so many people and so many cameras, I was so passionate about it that I was able to get over that fear. And I feel like it's made me identify myself a lot better and recognize my own strengths that I didn't even know I had, because I was so. It's a shame that it took a life-threatening disease to make me realize my own worth and how much I'm capable of. But so in a way, although it was so hard for me to get through, I am very grateful because it shaped the person I've become now. And yeah, I don't recognize the person I used to be before it, but do I want to? I'm happier with the person I am now because I actually have a purpose of what I want to do and who I want to help and where I want to go in the future.
Yeah, I think that's one thing that I think many times when it comes to life-threatening diseases, people that survive them, even like a lot of times people don't want others to feel sorry for them for having it,
Mhm.
because you're the only one who can actually see that it has made you stronger and there's so many good things despite the bad
Yeah.
happening. That it's even like when it comes to hardships, I think unless somebody is in really in a situation where you deal with like really big hardship, not like, I don't know, let's say if you didn't have TB and you had to finish 2 semesters in one, it's still a bit hard, but it's not like a really hard situation to go through. But
Mhm.
in your case, it was like you fight for your life and you finish uni,
Mhm.
and the
Mhm.
COVID happened as well. So like many
Yeah.
things they happened at once that
Mm.
um going through those hardships, it's like I think it's not just when you fight like life-threatening disease, it's just any hardships that you go through, they actually make you stronger. So like how would you
Yeah.
say, what would you say is the importance of um I don't know, let's say, okay, let's, what did you say are the hardest things that you had to overcome during this like period of time that you had TB?
Um, the hardest was probably coming out of isolation. I found that very difficult, and I found that very difficult because I couldn't acknowledge what was going on. I didn't really suffer from like anxiety or things like that before I was diagnosed. So when I came out of isolation and I started feeling weird to, I know there was a part of you when I was in Liverpool that I couldn't cross a specific road once I came out of
Oh yeah,
isolation. Before
I
I
know
came
which
out of
road it was.
isolation,
I would
and
I remember I sent you a picture of that road and I was like, are you crossing it? When are you gonna get it done?
and that road, I couldn't understand why every time I'd get to that road I'd divert my route and I'd just go around the other way. I wouldn't even think about it, it just naturally happened to me. And then when I used to walk to the library, um I used to feel like everyone in the library could see me and all eyes were on me. And I think that road that I couldn't cross was such a long road, and all the cars are parked at the traffic light, and I just felt like all the attention was on me. And I think it was because, now that I think about it, I think it was because I was so used to no one looking at me, being completely on my own, to now all of a sudden being just let out into the world again after 50 days of being completely isolated, to be around other people that I just didn't know how to react. I felt like everyone could see me differently because the person I was before I went into isolation and the person I came out after isolation was a different person. And I felt like everyone could see that different person, even though my PIC line was obviously covered and no one could see the pigmentation on my skin or the redness and stuff like that. I felt like everyone could see a new person and it was just all eyes on me, and I struggled with that a lot. But again, when I reached out for help, it was very hard because there was no one else going through the same thing as me. So there were no focus groups or no support groups that I could help with. I was very lucky to have a lot of nurses and doctors that were very friendly with me and would text me and come to see me. So I didn't feel very unusual, but that was the battle I had to face because I didn't know what it felt like to be so alone and then completely let into the public. I had instances where because people can't see your condition, they can't help you, or they'll treat you like you're just a normal person. And I had an instance where I used to go for my IV medications, and I took the lift. My therapy was on the third floor, and I used to wait for the lift every other day. And this lift was really busy, and I basically got into the lift, and this old man, basically just looked at me and was like, "Well, why are you in the lift? You shouldn't be here. You're quite young. Take the stairs." And there was around like 8 people in that lift before. This was all before COVID, and I stayed quiet. And I hate myself for staying quiet in that situation. I couldn't open my mouth and say to this man that, wait, I have a PIC line. I'm going for IV therapy because I'm suffering from tuberculosis, multidrug-resistant tuberculosis, where it's in my lungs and I struggle to breathe if I walk for too long, let alone climbing 3 flights of stairs. But I couldn't say anything to that man because tuberculosis is so shamed. I felt like, oh, if I say I have TB, every single person in this lift is going to be scared of me and they're not going to want to be around me. And now that I think about it, as soon as it happened, I was like, damn, I should have said something. I should have stood up for myself. And I probably would now, but it's a bit too late.
I think it made me think about many times it doesn't even have to be having a disease, but like, let's stick to the disease. When somebody has a disease, they are ashamed of it. So maybe if you felt shame, you didn't want to speak up about it, because like it's mad as it's as if you would be embarrassed of having disease. But like, if maybe once you start owning it and you actually feel proud of yourself, and
Yeah,
it's like it's part of your life and you are proud of yourself that you actually are going through this and you're getting stronger, I think that's when you're able to stand up for yourself.
yeah. I think, yeah, definitely. Now I'm so proud of saying, oh, yeah, I survived multidrug-resistant tuberculosis. Like, I'm very open about it. I have my own Instagram pages. I'm quite active on Twitter, and I'm doing a lot of work where I'm recognized as a multidrug-resistant tuberculosis survivor. I found it hard to say that I was a patient because I wasn't necessarily embarrassed or ashamed of what I was going through, but I know people wouldn't accept me for me if I told them what was wrong with me, and I would rather not tell anyone and just be treated normally than be treated differently in a wrong way. Because I feel like for example, let's take COVID-19 into perspective. Everyone knows about COVID-19, but no one realizes that tuberculosis, even though right now currently COVID-19 is the world's deadliest infectious killer, tuberculosis is second in the world.
And it was
It
first
kills so
before
many people.
COVID.
Yeah, but now that COVID, obviously I know COVID has killed a lot of people, but tuberculosis is still killing so many people and there's no recognition for it. Nothing. So when you do mention TB, I'm not surprised people get scared because there's no information on it. But if you mention COVID, there's so much there's so many posters and so many people talking about it. The news is always about it. But before COVID, there was no news lines about tuberculosis and how hard that was for people. When you go to a doctor's surgery, there's no posters of, oh, there's posters for like, oh, breast cancer and stuff like that, which is equally as important. But why is there never a poster to say, check your signs for tuberculosis? These symptoms, if you feel like you've got these symptoms, talk to the receptionist, talk to your GP. Because if I had seen something like that when I started getting this cough, when I started getting the sweats and weight loss and stuff, I would have automatically thought to myself, I need to go to a doctor because I might have tuberculosis. But because I didn't have that, I didn't think to do that.
Yeah, makes sense. So how does that maybe like affect you, or maybe for you as a TB's previous patient's survival, how does it feel maybe? Because I think many times what happens is that when you have really serious disease, the extent you identify with it, because like it's not something that, I don't know, my leg hurts a little and it just goes away, but it's something you live with constantly.
Hmm.
How does it affect you that, or maybe what it makes you think that when you see that there's so many posters about other diseases that are um as life threatening, but there's pretty much nothing about yours, as if it's mm, well, not that it's not important, but it might seem like that, seeing that there's pretty much nothing out there, or like you couldn't find any support groups and things like that, when you felt like you just didn't know what you're actually up against.
Yeah. Um, I started off feeling very annoyed, and I was in a mindset where it was a bad mindset because I used to think that I started off with not having emotion towards people who are suffering with stuff like that has recognition, or like, because I always felt like, yeah, but I have it worse, or I have it the same as you, but there's no help for me, whereas there's so much for you. Like, you're so like you, it's not fair that. So I eventually started off with not feeling sorry for people, because I felt like, well, no one really has that for me. No one really sees what I'm up against. So why is it, oh, when you have a certain condition,
I
there's so
think
much like
another
help
thing
for
is that
you?
you
And
didn't show people that as well.
yeah,
It's
but I
like,
felt like there
okay,
was
like
no point.
society is not educated, but was it also, it might have affected the fact that you didn't feel maybe safe to share that because nobody really knows about it. If it was like,
Mm,
let's say, if it's cancer, then if you share about it, then people know what it is. So
mm,
that might make you
yeah,
feel maybe more secure, more like it just
yeah,
feels more likely you're going to share it with people.
yeah. But so when I realized that there was nothing out there for me, I basically stopped thinking like that, because I realized that everyone has their own struggles, and even though right now mine seems bad, I 100% know there's people out there who have it worse than me. Although for me, this
I
was the
remember
worst I could have
I
been.
was like I was suggesting you to help you with uni and things like that because like obviously you're like not at your best health, and I just wanted to help you with like having like a lot of
Yeah.
energy and things like that. I said I can buy you some like groceries and bring them to you and things like that. And you're like, no, 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 I'm good, I don't need like you would never like ask for help, or maybe even admit that you need that or you would benefit from it. You wanted to, and I
Mm,
think we also, when we went from Tesco that day, we also talked about how important it is for you to still feel that even though you are sick, you're still able to be independent, that you don't
yeah,
have to rely on other people.
yeah,
But at the same time,
yeah,
you're a bit like making it harder for yourself.
yeah. I feel like being independent was a big thing for me, because I realized, like, at the start when I used to, so you have to go to clinic every so often, every couple of weeks, to see your consultant, and then obviously get your medication and stuff like that. And when I used to walk into the clinic room, everyone had someone with them. So like everyone had a family member with them, and everyone was a lot older than me. So it was like a father and a child, a son bringing his dad, or something like that, husband and wife coming in, and everyone had that support system. But at the start, I used to think, oh, I actually have no one. I was 20 years old. I had to use Google Maps to get myself to the hospital, because I've never been to the hospital in Liverpool. New city, new hospital, new doctors, everything, and it felt quite lonely at the start. But I slowly, like, as time went on, I was very proud of myself, of how independent I was, and how I was able to go through all my appointments on my own, taking all the information from my doctors on my own. And it really helped that the consultant I had in Liverpool, he's great for me. Like, I couldn't have asked for a better doctor to help me get through this. So I think that helped a lot, and that
So how do
changed my
you deal with
mindset.
that loneliness at the beginning?
Um, I think I think it was obviously seeing my friends. Like, I saw you quite often. I used to see my friends. Like, my parents would, always like check up on me. I'd have my nurses that used to come and visit me at my room. They'd text me to see how I was, occasional phone calls. Obviously, I have my faith that helped me quite a bit, because if I felt very alone, I knew in the middle of the night I could wake up, and I didn't feel alone like that. And really just focusing on what I wanted to do after this. Like, what I was always determined to figure out what's next. And when you asked me that, oh, you know, there was no recognition about your condition, how did that make you feel? I feel like now I took matters into my own hands, and I'm trying to bring recognition to my own condition by doing work around it, by going to these talks, you know, being part of the WHO Civil Society Task Force for TB, being part of loads of different executive committees and stuff that concentrate on eradicating TB, and that give importance. And that's where I feel most important as well. I feel wanted in places like that because I'm important there. But when I'm not in that
And
surrounding,
you're also wanted for the fact that you have that disease. So it's
yeah,
like, it might even be like empowering, because it's not about, oh, like, we don't want you because like you have this. We actually want you because you have it, and you can share your
yeah,
experience, your knowledge,
they
and
see
things
my
like that.
importance.
Yeah.
Yeah, they see my importance and see what I can bring to the table with my condition. Whereas I had instances where I remember when I first wanted to get transferred to Liverpool to carry on with uni, I had to go through a disability process to help me with my laptops or whatever. And I went to the appointment, and the lady walked out of the room and with no explanation or anything, but it was just a case of, because she read my condition, she said, oh, I don't want to treat her, you know, she might be infectious. And it put me off so much that I never went back to them again. I said to them, I didn't want their help anymore. I didn't want to be helped by someone that can't understand what I'm going through. So I never went back to them. But things like that, like that's what I mean. Like, but when I'm working with people who are interested in my condition, I feel like I'm I feel like I'm wanted, and I feel important enough that my opinions and my condition actually is valued and matters,
And you can
and that's helped me a
also,
lot.
in like that environment, you can also blend together that like one identity with the other. You don't have to separate them in a way. That like,
Yeah,
let's
and
say
because
when you're in school, you have to be like, oh, I'm a student, but I don't show anybody that I have TB.
mm, yeah, and I feel like being I feel like the experiences I have being a patient, a lot of the people I work with are researchers or doctors or stakeholders and stuff like that. So for them to have a patient experience is a big deal because they don't deal with patients a lot. So I feel like I can bring a lot to the table by explaining how difficult it is to be a patient, really, and to have survived it. And now the things that I'm accomplishing obviously are on top of it, which I'm obviously very proud of now. But it took me a long time to understand that what I'm going through I should be proud of.
So what made you realize that? At what point did you realize that you're actually proud of yourself and that you're going through this?
It took a lot of persuasion from friends, family, my husband, my parents to tell me constantly that they're proud of me. And then obviously, once I was diagnosed, I was invited to talks by all these big people that suddenly all of a sudden had interest in me. And I've never had that before because I was just, you know, going through life being a uni student, school, you know, high school, college, uni, and I was just going to eventually find a job and, you know, settle down. And now all of a sudden I have this bad disease, this life-threatening condition, but now there's this popularity where people want me and people want me to attend these talks and give my experience and my journey. It was like a sense of importance from people that you wouldn't expect to look at you twice. But now all of a sudden they want to know my story and they were interested in me. And I feel like they really helped me because they constantly reassured me of how important me sharing my journey is for them. And like they give me that importance. And I slowly started to realize that, okay, if these people think that genuinely what I have to say is meaningful and empowering and, you know, it touches them, then there must be something in my story that I'm not seeing. And I still tell you to this day that I don't see what I went through as a big thing because I just had to go through the motions and I did that very easily when I think about it. But when I look back, if I sit down, and I don't let myself do this often because it's probably a scary place to be in looking at what I went through. But when I do try and even think for a glimpse, like for a moment about all the things I went through, I see that these people that constantly invited me to these conferences and stuff were right. Like what I have is important and it can help someone. So I think that's what really pushed me out to understand that, hold on, what you've done is incredible, really.
Yeah, like I'm always interested to like, I'm happy we're having this conversation because I have always wanted to ask you more questions about how you actually, well, first survive this, but also make it look so easy. Like
Mm.
at no point did you complain. Like I never felt like you would complain or anything, or even the fact that you would bring it up in conversation, unless I would ask you most of the time.
Yeah.
You would just like have conversation. I would be like, "Oh, how is your health?" And then you're like, "Oh, I have a stomach ache. I have this. I have that." But like, at no point did you like complain about it. We can have a conversation, and unless I ask you something about it, you would never show that you're like in a bad pain or something like that. So it's like one thing I wanted to talk about is how do you deal with um constant pain that you have, like it's one thing is that you have pain for like, let's say, few moments and then it's gone, or maybe
Yeah.
like few days. But if it's like months, maybe years, and you just
Mm.
feel that pain all the time, how do you deal with having like constant pain?
To be honest, I'll be very, very honest with you. I still to this day struggle with how to manage it on some days. I sometimes waking up in the middle of the night is probably one of the worst things for me because the pain is so intense that every night it wakes me up from my sleep
So where
to,
do you have that pain mainly?
it's just my stomach pain. And it starts and there's no given time for when this pain comes, and I'm constantly taking painkillers to help myself. And right now the only way I'm having this podcast conversation with you is because I have started a course of steroids, and once I take steroids I do really well with them. But I know that the anxiety, I'm so anxious about stopping these steroids because I know the pain is going to come back, and it's tried and tested that every time I stop the steroids the pain comes back. And there's
And you
days
also
where,
don't, and I know you remember you told me as well that you don't want really to take them.
yeah, I feel like the side effects are so strong that I don't want to. I feel like I've fed my body so much medication for so long that I want to give it a break, but I can't because I can't handle the pain anymore either. And if you saw me in the house some like most days, I'm usually curled up into a ball, into a fetal position. So my knees are literally attached to my chest and I'm curled into a ball the whole day sometimes. I can't eat because my stomach's hurting so bad. So until I take painkillers, I can't bring myself to eat because I'll just vomit. And the pain is so intense, I'm constantly vomiting. Or even when I sleep, sometimes I'm in a fetal position because of the pain. And I don't remember the last time I got to lie on my back flat because the pain just won't let me. And that's annoying for someone like me because I find it quite comfortable. When you're lying on the sofa watching telly, you lie on your back, but I
Mm.
can't do that anymore. And obviously, I really appreciate when I'm on the steroids that I'm able to do stuff like that. I'm able to get into the kitchen and cook and clean and do my uni work. And let's not forget, I still have a master's degree to get through for the whole year, and it puts me behind a lot sometimes. But I have obviously support at home. Like I live with my husband, so he helps a lot, and he always tells me how well I'm doing, which is really helpful because the worst thing is when you're not feeling well and then you feel like you're a burden on this other person that you have to live with. Like, although I'm married to him, I know we talked about this before, I feel like I'm married to my own condition too, and I can't get away from this pain. And there are days where I feel very upset and I just want to cry because I don't know what's wrong with me and I don't know why this pain is happening and I don't know when it's going to stop. I have no idea when I'll be rid of this pain, and I don't know what's caused it to be so bad for me. Like I felt like having drug-resistant tuberculosis was the worst it could get, but now that I've conquered that, I can't get rid of the second phase. Like it's like you have to win some to lose some, and in order for me to be cured of the tuberculosis, I've now been left with this abdominal pain that I can't get rid of either. So I do try and appreciate the days where I don't have the pain, or the few hours that I don't have the pain. But when the pain comes back, like I'm so anxious to leave the house now, like going for a walk or going for food shopping. Like I'm so scared because once that stomach pain attacks, that's it. I can't even stand up anymore. Like there's no way I can do anything. And it does limit me a lot because I would love to go for a walk every day, but I can't do that because the pain won't let me. So I feel like to be 23 years old and to be worried about leaving the house is very concerning to me, because that shouldn't be my main concern. My concern should be elsewhere, not worrying about, I have to schedule my life around my pain. I can't wake up
Which
if
like you
my
can't really schedule because it comes and goes, right? It's not like you
yeah,
can,
so if
oh,
my
today from
husband
this
asks
time to
me
this time I'm gonna have pain, then we can do something.
so if my husband asks me, oh, what would you like to do tomorrow? I'm like, well, that's not up to me. Or I'll let you know, because when my stomach hurts, then we won't be able to do anything. But if my stomach's fine, we're fine to do whatever you want. And you won't believe it, but I have painkillers next to my bedside. I have painkillers in the car. I have painkillers in my uni bag. I have painkillers in the living room, in the kitchen. I'm constantly surrounded by painkillers because I don't know when that pain's going to come. And I don't want to stop living my life, but I kind of have to slow down, and slow down by a very large amount. For someone my age, I didn't expect, like, I remember thinking, I'm 23 years old, and I didn't expect my life at 23 to be the way it is right now. And I don't remember, I don't even remember that it's been almost 3 years since I was diagnosed, because from 20 to 23, it's like my brain doesn't want to remember the time that I've had. So sometimes when people ask me how old are you, by accident I do end up saying I'm 20, because the I don't even want to, it's like my brain doesn't want to remember the trauma I've been through for 3 years, the pain that I've been through. So I almost think that my life
Like at the time you didn't
basically,
really realize it was a trauma, right? Like it didn't feel like it. You were just taking it
yeah,
day by day. But at the same
I
time your
feel like
brain is
my
trying to
brain
protect you
has,
from that period of time.
yeah. And I only recently realized that when people ask me how old I am and stuff like that, I automatically, I feel like I don't want to remember the years I've had after 20. I feel like when I was at 20, it was, until then it was good. And then from 20 to 23, it's just been full of like medication, doctors, hospitals, pain. And my brain just doesn't want to remember that. My brain wants to stop at 20. And that seems to me is very traumatic, because if my brain doesn't want me to remember something, clearly it has to be bad enough for it to just, I think sometimes that after 20, like, I've not really had a life when I think about it, because my pain's been my life.
How can you how can you still enjoy life while going through this? Because like many times when we have conversations, you're like really positive, we joke around, like even TB, you still joke around it, you don't, like,
Yeah.
let's say when we joke about it, you don't feel offended and things like that. So like in a sense it shows that you have accepted that it's part of your life, that you're even able to
Mm.
joke about it. But it's like, how do you still maintain like joy, or how do you still enjoy life while still fighting this?
I feel like one thing I really think I learned from all this is to not take your health for granted, because eventually it catches up to you. It catches up to you. And I know this sounds weird, but some days I feel so jealous of people that don't have any pain. Like, I'm really happy for them,
Well,
but
it makes a
I
lot of
feel,
sense.
no, like, I feel I'm very happy for, like, seeing people around me and like my loved ones that are in good health. But some, like, just for some moments, like I do feel like I wish that was me again. And I can't, like, I wish at 20 I just appreciated my health a lot more than I have now, because I appreciate it a lot more, and I wish I gave my body that time that it needed, because I do anything, I would literally do anything to feel healthy and be in good health now. And I didn't realize the importance of that. And I wish I did,
I think
because
it's
I
like
would
that
have,
with most of the things, that you don't appreciate them until they're gone. And health is like
yeah.
really important factor, because if something is wrong with your health, you will notice it, even if it's like a sore throat. You can be in like on a beach, chill, and you can feel sore throat. That's all you're gonna think about.
Yeah, yeah. No, I really, 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 like, I always tell myself that the day that I don't feel the pain, or the few hours that I don't feel the pain, I'm going to make the most of that, because I don't get a lot of time away from the pain. And I still tell myself that once this pain goes, I will literally do everything to look after myself and make sure I don't hurt my body or do anything to put it at any risk, because I want to protect that now so much. And I wish I didn't have to go through all of this to
Yeah.
realize that, but I'm glad I did, because
It's
I
a good
probably wouldn't have
lesson.
still realized it. Yeah, like I still tell people around me that you don't know how lucky you are to wake up every day and be able to just think about what you want to do in the day and think about your life, rather than thinking, yeah, but my body, I have to stop, I
Even like
can't
go
do
for
that,
a
because
walk.
yeah, I sometimes feel so anxious to leave the room, to go outside or to go shopping or do
So like, is
anything.
it
Like I just,
mainly the pain that causes that anxiety to leave?
yeah, definitely. It's 100%. The pain just makes me feel like I can't be normal. Like I can't be a normal human where like you can just, you wake up and you're like, oh, I need to go for a walk, or I need to go shopping. It's quite easy for people to do. And I know how easy it was for me before, but now I'm like, is it necessary? Do you really, really need to go?
Yeah.
Because if you don't, then there's no point. Don't risk it. Sometimes like my husband just goes shopping for both of us instead. And other times when I'm feeling okay, or I'll take sometimes I take the painkillers before I leave the house, because I don't want to be so limited as well, because otherwise I'm constantly at home, and that's not good for you either. But where is the fine line between battling your mental health by not leaving the house or going anywhere or socializing, or do you protect your body and listen to your body and stay at home? Because either way, you're going to be struggling. If you don't leave the house, you're going to be struggling mentally because
Yeah.
you've not socialized or had fresh air. But if you stay at home, you're still struggling with pain. So which one do you go for? And I always end up going for the pain, because the pain is a lot more for me than battling my health mentally.
Yeah. So how do you deal with that? Well, pretty much, I assume most of the time you just spend where you live. So like you don't, and it's something that's relevant to anybody now with all the lockdown
Yeah.
going on. So like,
Hmm.
I don't know, how do you deal, or let's say, how does being in lockdown and having your pain compares to your isolation?
To be honest, I didn't find this lockdown that we had, this national lockdown, so difficult, because I kind of felt like, at least this time round, I'm not alone. I'm not constantly
Oh,
taking pills, constantly having blood tests, and I'm not cooped up in a room where I can't do anything. Like my room didn't have a TV or anything, so I had to rely on my phone, and like there was no Wi-Fi, so I was my internet. And
and you
when
had
I'm
only your
here,
mom to come and visit, right?
yeah,
Because I
and
didn't
here
know
at
that
least.
what
Well, no
what
one
was
was allowed
happening.
to visit me. No one was allowed to visit me but my mum, because
Also,
she'd
like
been
there was
tested.
nobody even allowed to visit.
Yeah, no, I
So
wasn't
like
allowed
even
any
if somebody
visitors.
wanted to visit you, it probably wouldn't be
No,
possible.
I had like a little window
Yeah.
where if you wanted, like desperate, like for example, my dad wanted to come and see me, then he'd be able to just stand in that little window and like see his daughter, kind of thing. Apart from that, no one, yeah, because you had to basically gear up with the whole mask and the whole suit before you actually entered the room, and I felt like
Hmm.
they didn't want to risk anyone of exposure to it whilst I was infectious. So I feel like this lockdown, I feel like although it's hard, I think people should be a lot grateful, because at least they around people they care about. So you're not always on your own. You can still leave the house for a walk. We're still allowed to go for a walk or go shopping. I wasn't allowed to do any of that. I had to stay in my room, and they're still healthy, right? Because
Yeah.
the first day I started taking my medication, I was in isolation, but my tongue started to peel, and I couldn't even enjoy my food anymore, because even that had gone. Anything with even a kick of spice, my tongue would literally be on fire. And I think people, I think if there's one thing I would love for people to understand, is that, yeah, times are difficult, but you don't know how lucky you are to be in lockdown whilst being healthy, because you'd rather be healthy and in lockdown
And
than be
also be
unhealthy
able
and
to
not have a
like
lockdown.
be, let's say, go for a walk or still be able to physically be active. It's not
Yeah,
like that restricted where you just have to be in your room and you can't do anything else but be in your room. You can
yeah.
still
Like
go
I
for a
know a lot of
walk.
people have, yeah, a lot of people have picked up hobbies like, baking and stuff like that, but I can't even do that because I might try and bake, but can I stand in the kitchen for too long? No, I can't stand up for that long. So what would take a normal person maybe an hour to do in the kitchen would take me a lot longer because of the simple fact that if I'm stood up, my body's not in a fetal position, which means I feel like my stomach is stretched, and that means the pain's there. So I'd have to do a bit,
Also, once
curl
your
up into a
stomach is
ball.
stretched, that's when you start to feel more pain.
Yeah, that's why I can't lie on my back or anything because the only position I feel most safe and comfortable is when I'm curled into a ball because everything is together and the pain just seems a lot less. If I'm stood up, if I'm sat straight on the sofa or lying down or anything, lying on my stomach, lying on my back, it doesn't matter. If I'm not in a fetal position, I'm in pain. So you can imagine being
How
in the kitchen.
how long ago did you finish your, like, all the treatment and everything? Because that's another thing, is that um one thing is that, okay, you have a treatment, which we talked about last week as well, is that you have a treatment, and then a lot of times what people assume is like, okay, this is it, you're healthy now, all is good.
Mm,
But you finish the treatment and that's not really the end of it.
yeah. I feel like your whole life eventually changes once you've been through TB. There's no going back. There's no, you can just resume from 20 again. You're stuck now from 23 onwards, whatever life throws at you, you've got to take in. And I feel like you're right. When people say, oh yeah, you finish your TB treatment, oh, everything's okay with her now. But you don't know how much pain now I have to go through now that I've been treated of TB. Because if it wasn't, if I didn't have TB, then I probably wouldn't have had the stomach ache from the medication or whatever the cause is. I firmly believe that something from the treatment I had has caused the stomach to hurt. And so I do think that, oh, maybe if I didn't have TB, then I wouldn't have the stomach pains. But even though I finished the medication for my treatment and I've successfully completed it and I'm better from the TB, I'm not better from the pain that I'm being caused now. So you never really get better, do you? You only just learn to adapt to this new life that you have with post TB symptoms and post TB treatment, really. I'd still call this abdominal pain, it's just post TB now. Everything that's happened during treatment has stopped fine, but I'm still going through the motions of, I'm still a patient. I've not stopped being a patient since I was 20. It's been 3 years and I'm still a patient to these people because I'm not better yet.
So, like, how does it work? Are you TB free, or I don't really know how it works. How you know that, like, let's say once you finish treatment, does it mean that you don't have TB anymore, or like what happens
Yeah.
when once you finish?
So I don't have tuberculosis anymore in my lungs. So
Okay.
it was my left lung that was affected, and the medication that I took has cured the tuberculosis. It was a very extensive damage that happened to my lungs, so I do have quite a lot of scarring on my lungs. But apart from that, I did really well with my medication and treatment, so I have um finished the TB. There's no TB left in my lungs or anything that's going to cause me any issues. But obviously, the scarring on your lungs, it means you're still breathless quite often. You can't run for that long. And for
And
someone
like, you
that was quite
can't get
sporty,
TB again. Like, it can't come back. It's once it's
oh
gone,
no,
it's
you
gone.
can.
Like, how does, like, okay, so it can't come back
Yeah.
if it decides to.
Yeah. So if I catch it from someone else again,
Oh,
there's
okay.
no saying I can't get it again. It can't just come from inside of me. But for example, like if I come into contact with someone with TB,
Oh, okay.
I'm not safe still. Like I could still get it. That was a big question for me. That can I get this again? Because I do not want to go through this again.
Yeah.
But even though I've taken all the medication for it, there's still a possibility. It's a very obviously unfair. Like it's a situation to be in, and it's probably very rare to happen to get it twice, but there is still opportunity that if I came into close contact with someone and my body and my immune system reacted, then I probably could get it again. Yeah.
Yeah, so the only way you can get it is if there's somebody who has TB and you get it from them.
Yeah.
And then you have to go
Yeah.
through the same process of
I assume it would
medication.
be the same
Okay.
process. Yes. Yeah. Because I don't think, I think it would still be drug resistant.
You can't get rid of it that easily.
No, I thought that once you've had it, you can't get it again, but no, I was wrong. You can get it again.
So how does
I
your
feel like
daily
the
life look now?
at the moment with steroids, it's going great, but but without the
No
steroids, it's a
pain.
lot of, yeah, it's a lot of my daily life is a lot of talking to doctors about my treatment or what the next steps are to cure me, and I'm very lucky to have them quite hands-on. Constant appointments. I'm constantly having to travel from Preston to Liverpool, which is like an hour's drive for like small appointments or big appointments, all of them. And there's a lot of trying to balance uni with a house life, being a wife, just being a 23-year-old, really. Like sometimes I just want to chill out, you know. And my day-to-day routine is a lot of waking up, taking your medication, having breakfast, you know, then trying to keep going through the day, and then every 4 hours when the pain comes back, taking your painkillers again, and then taking a nap during the day. So I'm very lucky that right now uni is online, so a lot of the lectures are recorded now. So I'm hardly ever there for the live lectures anymore because I can't keep up. My body just can't stay put the whole time because the pain doesn't let me. So I do a bit of uni and then I'll have a nap for like an hour. I'll get up and then try and start again, you know, catch up with the lectures and the assignments and stuff like that. But that's literally day to day. And by the time I'm done, it's like the evening, and then I'm so tired because my body is exhausted from trying to balance pain, medication, food, uni. My brain is literally got so much going on that I just don't want to do anything. I just want to chill out and watch telly, or you know, I would love to like I would love to pick up hobbies, but I don't have the time to right now. And I don't feel like I have the energy in my body to do anything because I don't think I'd be able to carry through with it. That's the only issue. I don't feel like I can be committed to anything because I don't know when the pain comes back. Because as soon as the pain comes back, I have to cancel on things or I can't do certain things because obviously my pain controls me right now.
Yeah, like even this podcast, we wanted to do it Wednesday, but you said you still were like recovering from that procedure
Yeah.
endoscopy, and also you had uni, so I was just like, we can postpone it.
Yeah.
But it is something like, well, let's say for me, I know it, I don't mind it, I understand like that that's the way you are, and I'm not like, oh, you canceled on me or stuff. Like I actually suggested
Well,
that because I
we're
knew
in
that you
trouble if
wouldn't
you are.
you wouldn't want to cancel. That's why I was like, maybe we can
Yeah.
do it another day, because I know that you wouldn't want to cancel on me.
Yeah.
Like that's just like the way you are. But it's something that when you really respect others, it's like you can't really know whether you will be able to show up or not, because it's just the
Yeah.
way it is.
Like, yeah, I do find it very hard to say no to people because I know the reason I'm saying no is my own condition or my own pain. And I just feel bad for doing that to people, to say no to them because of something I'm going through. Because I don't expect everyone to understand what I'm going through, even though I feel like a part of me feels like they should understand. But then I also know that, but it's not their fault for not understanding. Because I feel like if you, for example, if you were going through something that I'd never been through, I'd still find it hard to find the balance in my mind to understand where you're coming from because I don't know what it feels like. Like you must, I'm sure you have things going on in your life that I never experienced, and for me to understand that, I have to be a completely different mindset to try and understand what you're going through, which is why I understand why people can't understand, and I don't expect people to understand what I'm going through, but I'm trying to do work to make sure people understand for other people that will go through it, you know, because TB is still around, that, you know, there are ways to support people like me because I would have loved that support. I would have loved the help, there's no financial help for TB patients. There's nothing out there for people like me, apart from the support you get from your own family and friends and the good
Yeah.
doctors that you have. There's nothing else. And they don't realize that you lose a lot whilst you're going through treatment, because you lose jobs because you can't work. That means there's no income. You're relying on your friends or your family, or
Yeah,
people that
you said in that interview that you lost your job because you had a TB, not because you
I
were
lost my
not
job
able to
before
do
I
it at the
was
time.
I lost my job even before I was diagnosed because of the symptoms. I was coughing, and obviously,
Okay.
if you're coughing, I was working around children in a store, and
Okay.
that meant that I was putting people at risk. So I had to give up that job straight away. Even before I was diagnosed with tuberculosis, I had no idea, but I had to leave my job, and that meant I was out of work for 2 years, 2.5 years. And once my nurses tried to get me help, we went through a whole process of personal independence payment.
Okay, now tell me
And
about this, because this was really annoying for me.
because this it's still really annoying for me. um it's basically a social protection package for people that have long-term ill health or disability. And what it is like, you basically they send you a booklet, and you basically have to explain. It's a very long booklet, and you have to explain your condition and what you struggle with, like what you struggle with at home, going outside, everything. Basically, they ask you everything and they score you. So you send this whole thing off, and they have a score system of 0 till 12. So 0 being there's nothing wrong with you, and 12 being you need the most help financially because your condition is very serious. So I went and I applied for this whole thing, went through the whole process, and I got called in for an assessment. And they basically came back with an answer of scoring me 0 on every single department. So basically, not even one, not even
Yeah.
anything. I was 0 the whole way on every single. And there was a lot of questions, a lot of things to ask, and on everything. Not even once did they think what I was going through was relevant. Really, like there was no, and I didn't understand. And my nurses were like, no, that's impossible. Like if you're not eligible for it, then who is? Like it's impossible.
I
Like
I would react the same way. When you said like they didn't approve you, I was like, what do you mean?
yeah, I know. And we appealed again and again. They came back and said, nope, your condition still hasn't changed. We're still scoring you 0. There's nothing we can help you with.
Also,
And
like
then
the second time, it again was 0. It wasn't even 1.
no.
Wow.
and and after that, I came to a point where I was like, there's no point doing this, because you start to feel like, am I seriously going through all this and there's no importance for what I'm going through? Like really,
Yeah,
like
like you might even start to question whether it's like important or you just, I don't know, make it up.
yeah. And I just felt really horrible that why can't anyone see what I'm going through? Like I'm going through all this pain inside and no one can see it. And I'm getting scored 0 is very hurtful in a way, for if you think that you're going through all this for someone to say, well, what you're going through really isn't relevant. Like it's not that bad. Like, you can
But
manage
I
without
think
any help.
another thing we were talking about is before, I don't know when, but we were talking about the fact, I even told you, if you go, I think you wanted to go to hospital or something, and I said you to pretend like something is really bad, because what you do is you don't really show how much pain you have. You can have like
Yeah.
really bad pain and they're like, how do you feel? Yeah, I feel a little bit of pain. So like that's, I think that's like, and we were having conversation about this, is that many times when, if you are really loud about the pain you have, even if it's little, usually those are the people that get the most attention, because people assume that you
Mm,
have the most pain because you're the loudest. But if you are the one who is actually like, you're sitting there being patient, even though like you are having
mm,
really bad pain, but you don't express it, or maybe you don't want to. Another thing might be that you might feel like you don't want to like over exaggerate how bad the pain
yeah.
is, but at the same time
Yeah.
you might actually describe it as it's less than it actually is, because you don't want to be like over, like all over the place with describing it.
Mm,
And that also might be one effect, while let's say when you describe somebody the way you experience it, you actually maybe like, I don't know how to explain it, like belittle that experience that you're like, oh, I'm
Yeah.
having a TB, and they're like, oh, it's pretty much like you're having a cough. Like, well, no, not really, but something, you know, like it's like you, and I can relate to that in a way because like when
Yeah.
I would, let's say, when I was in hospital with, I don't remember what's the name of it, but like
Oh,
I
I
would go into
remember something
hospital,
was
yeah,
wrong.
and
Yeah.
I wouldn't describe it as something like bad or something like that, or I wouldn't even tell people because like
Mm.
I think it might be another thing is that especially if you're independent, maybe you don't want others to see that you're struggling or that
Yeah.
something's wrong because you want
Yeah.
to be able to take care of yourself. And I think once you're not able to take care of yourself anymore, like it's the last moment, that's when you might ask for help and there's nothing else you can do.
Yeah. Yeah. 100%. And this whole, even though like I was told that you know maybe you should exaggerate, and we had these conversations where why don't you tell them like it's worse than you're actually feeling, but I felt like I was telling them everything about how bad it actually is,
But
and if they're not
I don't
seeing
think
it.
it's even like over exaggerating. It's just about changing the way you explain it.
Yeah.
Because like I
And
think the way you would explain it, it's like you are explaining it a bit less than it actually is.
yeah.
Because you don't want to be all
And
over the place.
yeah, I just felt like I shouldn't have to necessarily prove to these people how bad it
Yeah,
is what
that's a
I'm
good point.
suffering, and I shouldn't have to beg for help, because if someone is ill enough to ask for financial help, they
Which is
don't want
hard
to
to
do
do.
that. No
It's
one
hard
wants
to
to
ask for
ask for
help.
help, especially financial help. No one wants to do that. So if someone's in a position where they are asking you for financial help, they shouldn't need to beg or make them feel like they shouldn't need to make these other people understand how bad it is. Like I shouldn't need to beg for it because you should understand how bad it is for me.
Yeah, and you end
Because
up feeling
fan-
bad for even asking.
yeah, and it took me so long to even get through to these people, and even now, like you know, my nurse helped me again the third time, and I'm currently now getting the lowest payment possible. Like I'm not even getting enough to pass me a month. Like genuinely, like every month, I basically, they basically, it almost felt like I was pestering them, and they've basically given in and been like, you know what, to stop her from coming back to us, let's just
Yeah.
give her the lowest rate of payment, because then she
Oh my
can't
god.
say that she's getting nothing. At least she's getting something, and I necessarily do not agree with the payment I'm getting, because I believe my condition to be a lot worse than what they've said. I should not be getting the lowest payment. But who's to argue with people that can't understand a person's pain? There's no point. You're arguing with no one, because no one sees the pain you're going through. They're not ready to understand. They're not ready to see that pain. They're not ready to open their eyes to it.
You know how ridiculous this is? My neighbor, he told me that um he knows a person. That person is like overweight. And she goes to doctor, tells that she has anxiety or something like that. She can't train because she's anxious and things like that. So what they do is they give her some like financial support, and she's getting paid every month, so now she can just live her life. Oh, and they also gave her a car because she felt like she can't move around or something like that. So rather than tell her go to gym or whatever physical activity, just be physically active, eat healthier, drink water, what like all the basics for health. They just gave her this,
Yeah.
and he said that now she has saved for like her mortgage or something like that, living from that money for like 10 years. And now you
See,
come
that's
and you
that's
tell
what
me that you
annoys
get the
me.
minimum payment, and it's like where's the, like I don't know, where's the justice in this? Because they're like, even if you were able to work, you would, despite the pain. But
Yeah,
it's just
100%.
it's so bad that you just can't work. So how is this fair that you get this like the least amount of money that you can get? Pretty much like just to get rid of you, just asking them all the
Yeah,
time.
literally. That's what I felt like when they came back with it. I was like, these people do not want me to bother them again. So they've shut me up with the lowest payment that I can't even argue with. And I can't argue with it anymore, because there's no point, because they're just not ready to see what I'm going through. So there's no point. It, it feels, it's quite mentally and physically draining trying to explain to someone that isn't willing to understand. Like I really enjoy talking about my condition and my experiences and what I've gone through to people that actually are interested. Like, I enjoy telling you things because you want to know, and you want to learn and understand what I'm going through. But you can tell these people, they don't want to understand.
Yeah,
They
it's
don't
like
want
if
to
you
know.
have to prove somebody how bad it
Yeah.
is, it's like I don't
Is
have
it
to
worth
prove
it?
you anything. It's like I am living it. You will never understand how it is because I am living it. You're
Yeah.
not living it. Why should I try to
Hmm.
convince you now that this is like bad? So
Yeah.
it isn't like I remember I was really annoyed when you said that you had like that they rejected you and something like that, and I was like, it makes no sense. Like,
Yeah.
if not you, who is going to be like more
Yeah.
likely to get it? But it is weird how it works. But like how do you manage to deal with, because like you still have some expenses when it comes to like health and things like that. So how do you deal with it financially, because you can't really get a job?
I literally rely on my husband. Like, I have no income at the moment. So obviously with the personal independence payment that I get, that doesn't cover anything. So we basically rely on my husband's wage, really. If I need something for shopping, bills, if I need to for petrol, because traveling to Liverpool every so often for one single appointment, you don't realize how much fuel that actually takes up. But no one covers those expenses. No one covers, oh, when I was in hospital and my mom came to visit me, who was paying all them parking tickets every day? That adds up to a lot when you think about it, but no one sees that. And I felt like it bugged me so much that there was no financial help for TB patients, that I've now decided, obviously with my master's and my research study, where we are making a survey for catastrophic costs for TB patients. So it's basically a survey where people can, you go through a range of questions to explain your financial condition and how your condition of tuberculosis is affecting you. And it basically lets them know what aspects you need help in. So what catastrophic costs you're going through, that could be like parking, diet changes, traveling expenses, is it hard? Are you the bread owner of your own family? So, if you've got TB and you're the breadwinner of your family, who brings the money in? Do you need financial help and stuff like that? And there's the WHO have made a booklet like that for people around the world, but there's nothing in the UK for that. And I'm very lucky that, because I've gone through it myself, I'm quite passionate, and I'm working on developing that handbook now for people that will come into good use for people in the UK, because they will be able to explain the catastrophic costs they are going through to eventually receive financial help better than getting, the lowest rate of payment for personal independence payment, because they can't understand your condition. This is specifically for TB patients. So
Yeah.
this is recognizing that they need financial help and they can get it. So it is quite interesting, really.
So is it like about their expenses, or also like specifically for TB, or just like overall as well?
It's like your whole lifestyle,
Okay.
but you're a TB patient basically. So it's for
Okay.
TB patients. So post diagnosis, even before you're diagnosed, what loss of income did you have during it, after it? Because there's people that, I was lucky enough that I could walk to the hospital sometimes, but when I couldn't, taking a taxi to the hospital in a city was a lot of money for a student,
Yeah, and there are
you
people
know.
that don't even live in a city.
Yeah, and you don't understand, like, TB medication is universally, globally, it's free, because it's such a long treatment, and TB medication you never pay for. But there's so many other expenses outside of it that people don't see. People just think, oh, her medication is free, so that's it. But all the other things
Even
really
the
add up.
factor that if you have TB, okay, you don't have to pay for medicine, but you can't work. You can't get money in because you physically just don't have energy
Yeah.
to work.
And you're wasting a lot more money on, like, traveling, time. You have to change the things you eat sometimes, because you can't stomach certain foods anymore, or you're losing too much weight, so you're on supplements and stuff like that. And everything adds up to so much. Like, eventually I stopped going home every week. I realized the best thing for me was to stay in Liverpool one weekend, and the other weekend my parents would come and pick me up, because I didn't have enough energy to even get a train anymore. And like that costs a lot every other week to pay for a student to be paying rent and then paying for their food and then paying for travel and stuff like that. You don't realize like there's not a lot of money for a student, like let anyone really, but if you're a student, it just makes it harder to live out on your own. And I'm sure you know, like it is hard to build up on your own 2 feet
Oh yeah.
and try and earn money whilst you're
I
trying to
can
spend
speak
so much
about
money
it
as
from
well.
like healthy person's perspective.
Yeah,
That by
yeah,
itself is
exactly.
hard when you're healthy. But now add the fact that you're fighting for your life on the side. That's a bit harder.
Yeah, exactly. It was hard, but I managed, not the best way, because I should have maybe fought for the help that I should have
Yeah,
got.
but like the question is, why would you even have to fight for it? Like you
That's what my
shouldn't
argument
be
was.
fighting for it. It
That
should
why
be
am I
like, okay, this is
explaining
your
to these
condition.
people?
Yeah.
Yeah, I didn't feel like I needed to explain to people that I didn't want to understand. I'm more than happy and open to talk to people that want to listen and want to understand, but I'm not ready to sit down with someone that is not ready to listen, because I could talk to someone and my conversation could mean nothing to them, but I could talk to someone else the same conversation and it could actually have an impact. And I'd rather do the latter and talk to someone that actually wants to learn or understand. So I feel like my experiences obviously have taught me a lot, really.
Well, I don't think it's only you. It's other people as well. Like those people that I showed your video to watch.
Oh yeah.
Yeah, so when I send those people your video, like a lot of people that respond to me that's inspirational and that like they
Yeah.
have a lot of respect for you. I don't remember the specific messages, but I wrote them out to you. So
Yeah.
but it's and the reason why I did it was to show you that I'm not the only one who sees that. That I don't see it as something that's
Yeah.
like inspirational, that it's that you actually are really strong and things like that. Because well, when a friend says that to you, you're like, well, obviously you have to tell me that you're my friend.
Yeah.
So
Yeah.
that's when I was
100%.
like, okay,
Yeah.
how can I actually show you that I'm not the only one? And most of the people, if not all of them, that watch that video, they don't even know you. All they
Mm,
knew about you was what you said in that interview, which is like 15
yeah.
minutes. And I
No,
had no
honestly, that was
negative
very
comments.
helpful.
And
Yeah.
many were also surprised on what kind of conditions you had, that like the shower was broken and things like that. They're like,
Mm,
wow, how, how,
yeah.
like, why would you have that kind of conditions?
Yeah. But
So
at the
like
time, I
it
didn't see
is
anything wrong with
inspirational.
it. Yeah. But now that I think about it, there
It
were
wouldn't be
so
like
many
that.
things wrong. There were way too many things wrong, but you just don't see it when you're going through it, I think,
So
because you're
like,
so focused on other
yeah,
things.
you're focused on like pretty much, I think, pretty like fighting it on the current day. You
Yeah.
don't really think about those things because
Mm,
um if you had like two experiences to compare, when you fight it first time and second time, which hopefully you never have to do, but like then if you first time you had perfect conditions and second time you can be like, okay, did, like, you know what
yeah.
you would want to, but once
Yeah.
it happens, you don't really know. It's just like a new experience. So whatever
Yeah.
happens, you
Yeah. No,
just deal with
definitely.
it. So it's not something that you're
Mm,
like, and again, like you said that you didn't want to maybe like bother people, so you wouldn't go and complain
mm,
about something that you're feeling like they are actually trying to help me, so why would I go and complain
yeah.
about something? So
Yeah.
another thing I wanted to talk about was the importance of support, even like having your husband there and supporting you even now after all the, even having him. I remember, I think you said you had a conversation that you said him that, I'm gonna be like this, like, might be forever.
Yeah.
He was like,
Yeah.
yeah, I know.
Yeah. I'm very grateful for that, because I remember when there was a point where I went to this meeting and there was a conference that I was invited to, and there was lunch afterwards with quite, like, respected people and stuff. And they were just talking to me about all the things, like, like, oh, you've done really well and stuff. And I was like, yeah. And like, this is when I was going through treatment. And I was like, yeah, and oh, someone mentioned that, oh yeah, she's getting married, and you should have seen the shock on these people's faces, because for someone with TB to get married is a very big thing, because people don't want to marry people with tuberculosis.
Why is that?
They're not wanted in society. It's a shameful thing. Like, I had a client in Kenya a few months ago that I did a mentoring for, and he didn't tell. He was a teacher, and he didn't tell his boss or his manager or whatever that he was going off sick because he had tuberculosis, because it was so, like, it's such a shameful thing. There's so much stigma. Like, no one wants to know someone with TB because it's obviously a disease
Wait,
of
so where does it
poverty.
come from? Why is it like that?
It's more, I think it's, personally, I think it's just there's not enough. If someone tells you a disease is contagious, like, all of a sudden COVID-19's happened and it's infectious, and you can catch it from coughing and stuff like that. Everyone's wearing masks, and there's a 2 meter distance and stuff. But we should have probably been doing that already, because TB is the same way. It's contracted the same way, but no one did that. And I feel like having TB is obviously, it's a disease of poverty, and it's also, I think it's just
So is it
a
shameful
big,
because it's disease of poverty, or like,
I
I'm
think
just
it's,
wondering, one thing is that I don't know, you just don't want to have people around you that are sick because like you can worry about them, or like it's not something that
yeah,
anybody would want. But if it's something that like there's a shame attached to that, I'm wondering like what's the reason
there's a big
why it feels
shame attached to TB, a massive shame. And I've seen that everywhere I've been, where people don't like talking about their condition, because once not, like, I feel like the biggest thing is that people don't want to deal with people with TB because they're infectious, and because they're contagious, and because they're going through something that, and if you're unknown to something, the fear of the unknown is bigger than when you know everything about something. So with COVID-19, everyone knows everything about it. So even though there's fear about it, it's not as bad. But with TB, like, people the people know the main facts, that, oh, it's contagious, it's infectious, you can die, it's the deadliest disease killer in the world, and but people don't know the rest of it. So the unknown is more scarier than knowing about it, because what the facts that you know about it is scary enough. And I feel like if you've got TB, you become a burden, because you can't do anything for yourself. You're not bringing any money in anymore. You can't provide for your family. If you're the main breadwinner of the family, you can't work. That means you can't be around people socially. You're not well anymore. And it's just so stigmatized that people never used to tell others when they had TB. And I feel like that's very unfortunate, because I'm very proud to say that, oh, I've passed TB, but a lot of people can't do it. And I feel like that's the hardest thing, that if there was no stigma attached to TB, I think it would be a lot easier for people to help people with TB. But I feel like a lot of people back out from
or
helping
even
people with
just
TB.
like talk about it.
Yeah, yeah. Like, it's not a normal conversation. Like, TB, like, I don't know a lot of people that know what TB is. And it's a shame, because I'm not gonna say
Like
it's
in
an
my
interesting
case, I didn't
disease,
really
but
know
it
it
is.
until you got it, because I have heard it.
Yeah,
I have heard the name, but that's about like as much as I knew about it.
yeah,
But I
me
wouldn't
too.
say I'm too educated in this kind of things anyway, so
Yeah, no, me too. I wasn't. I had no idea what my own body was going through until I, Googled my way through it, really. So, yeah,
so I can what you said now, that once somebody has TB, they can't really contribute much. So like I assume that might cause them to feel like they are, well, to exaggerate, worthless. But like you can't really add anything. You can't really help.
yeah.
Um and it's like financial, or even like, I don't know, going to the shop or something like that, it can be hard. So how can how do
I
you
mean,
deal,
that's why.
if it's something you experience, and if you deal with it, and how would you, I don't know, maybe suggest dealing with it, or challenging that thought or feeling?
I mean, back to what we were talking about was, people are shocked when people with TB are getting married or having, something like that, something that's normal. But it's like, wait, does someone actually want to marry someone with TB? Like, that's not normal. Like, and I was very grateful. I was very proud that, oh no, he does want to marry me, even though I had TB. But a lot of people, a lot of marriages break down, a lot of relationships break down. Like, you're not marriage material if you've been diagnosed with TB. You are like, it's almost like you're stained.
Or I believe
It's
like
almost like,
any life-threatening disease. I
yeah,
think
yeah,
many
and
times
I'm sure it's like that
once
for,
you have like some kind of disease, like nobody wants to like marry you
yeah.
or anything like
It's
that.
like, yeah, it's like you're broken goods now, and like you're no good for that part of your life anymore. And I know that it must be with a lot of conditions that it's like that. And I was obviously very lucky that I've met someone that wasn't like that, didn't have that mindset. But I can imagine it being very, very difficult for people to form relationships or socialize with people because they constantly feel the stigma of what they're going through. And I don't think that's fair. But how do you change that perspective, if there's no recognition?
Well, I think one thing that from your example is really helpful is that you have this like places to go when they want to hear your story, so you don't feel like you're worthless.
Mm,
You can contribute nothing. You actually are special in a way that you can help specifically with this because you have gone through these experiences. So one thing that can be helpful be even like finding ways so you can share your story that can help other people, because
mm,
like we were talking a lot about the fact that once you started you wish you had somebody who would have put some content out or shared their experiences so that you can learn from them, or like
mhm,
maybe even less, feel like less alone,
mm,
because like there are people who have TB, but like they're, well, I don't know, but I assume you, from what you said, that there aren't many people, if any, that actually talk about it or post about it
yeah.
or share about it, that you see that that's actually an actual human being. It's not just like some, I don't know, some article written, or
Mhm,
I don't know, some scientific paper or whatever, but it's actual real human being talking about their experience.
yeah. I think that helps people a lot more because you we I don't know about you, but I quite like reading things people go through and like how they've battled through certain things, and they're quite interesting because it's quite a nice read, to see how strong people are. And I have to remind myself of that, of how I feel when I read other people's things, because I always feel like I made this Instagram page, and I've not been active on it for a while because I feel like, do people really want to read my life story? It's a bit boring. Like, we always talk about writing this book, but I'm always on the edge because I'm like, yeah, but people are going to get bored. No one's going to want to read it. But then I have to tell myself that I'm interested in reading other people's stories. I'm interested in seeing what they've accomplished. Maybe there are people who would be interested in reading about what I'm going through, and it could help someone. And that's what I want to do, help people, because I would have loved that help in my time, and I want to give that back now.
Yeah, exactly. And it doesn't even have to be somebody who has TB. It's just like any hardship. It is,
Mm-hmm.
there is something about it that is interesting to read or watch or listen about how a person overcomes this like obstacle that, like, in that moment once you are faced with it, you feel like, I don't know how I gonna deal with it or what gonna happen, or like
Oh
let's
yeah.
say in your case you didn't even know like what it is that you have.
Oh yeah. I clearly remember there was one night when I was in hospital and I was in isolation, and I was sat there and I was like, my mom left obviously because she used to come in the morning and then go in the evening. And I remember I was in that room at night, and it just came to me that, what if I actually die now? Like, what if, like, I don't make it out of this hospital room anymore? Like, what if this is it for me? Like,
Was it during the
genuinely.
isolation?
Yeah, yeah. I just had this fear because obviously I was told that the medication wasn't working, and now we're gonna have to put a PICC line in, because the plan was really to just be oral medication.
How does it
So
feel
I
when
just
you
take
hear that
tablets.
the medication is not working?
That's when I felt like, oh, maybe that was the like. So I was supposed to be just taking oral medication, and then obviously they realized that, oh, it's not enough for her body, so we need to start giving her IV therapy through a PICC line. And I I was sat there and I was like, okay, that means it's not working. That means the TB medication wasn't working, and now the drug-resistant TB medication isn't enough, and now they're going to try other things, and you don't know if they just trial and testing or they're confident enough. And I did think to myself that, what if this is the last time I just saw my mum, because my body is not reacting well to this anymore. Like, but I had to so quickly switch that mindset off, because I was like, if I start thinking like that now,
what made you switch it off? It's like,
I just
I don't think it's
couldn't let
something
myself,
easy to switch it off.
because I felt like I had a purpose. I felt like I wasn't useless. Like I knew that I was.
You didn't want to accept the fact that this is it.
Yeah, I was like, it's impossible. A part of me was like, well, if it is, then it's sad because I didn't get to see my dad either, or stuff like that, or my brother, and like, you know. But then in my head, I was like, but I'm here trying to fight something off. Surely there is a way to fight this off. Dying is not my last resort, and I'm not at 20 years old dying in isolation because TB took control. You know, I want to go to uni, and I want to, you know, get married and do all this. And, you know, I kind of realized that if I don't switch this mentality off right now, I'm going to sleep on it, and I'm going to wake up feeling horrible, and I'm going to go through the next day horrible.
And then
because
you would have to fight not only disease but also your mind.
yeah, and I didn't have my thoughts to go anywhere else, because I was so alone with my thoughts in isolation. I felt like if I start thinking things like that, I can't get out of that that mindset anymore. So I'd rather save myself and, you know, be positive whilst I'm in isolation, rather than
This is really
go down this
interesting
dark hole.
because I think many times what many people can experience, and I'm really curious if there's any way that distinguishes whether it's like the person or how it changes, is that in your case you're like, I can't be negative, but a lot of times many people in that situation, they would keep worrying about it, and they every day
Yeah,
they would be like, what if today is the day, what if today is the day? And especially when it's multi-drug resistant, because like the medicine is not working, and like,
yeah.
and you have googled everything, you know, like, do you know what are like the survival, what are the, what is it called, the death rate, or like how likely it is it that you can survive it?
It's very hard to, I don't know the exact facts, but I know it's very hard to survive, because it's so hard to, I think it's the whole topic of adherence. Like, trying to adhere to these medications for such a long period of time is very hard. It's like taking medication. The reason why you get nurses to your house every 2 weeks is because they're trying to keep up on making sure that you're taking this medication. Because if you stop taking this medication, then your body stops fighting it, and then you go into a relapse of it just gets worse. And they emphasize that all the time. And I feel like
So like
it
you
was
also have to be really disciplined with the medicine you take.
yeah. And if you, and I think that's where people, I think that's why the survival rate is harder and it's less, because it's hard for so many days, every single day, to wake up, take the same medication, take the same things morning, afternoon, evening, and go to the hospital all the time. And then you're not only trying to fight this disease, but you're getting side effects on top of that. And to tell yourself that it's okay to get these side effects because you're treating something else is very hard all the time, because you're just like, when does it end? It just keeps getting worse, and you know, you're
How do you
constantly going
stay
to appointments.
positive? How do you stay positive when things start to get worse? Because one thing is that, let's say you are going through treatment and you start to feel like something is improving, but then something bad happens. How do you maintain that positivity, or maybe don't go as much in those negative thoughts when that happens?
I honestly just had to constantly tell myself that I used to have like a little countdown for like how many days I have left till, you know, treatments ended. And like sometimes like the doctors would add a month on or take a month out, like, you know, or add 2 months on. And I used to be like, oh, it's so annoying because you've added an extra month of these medications and stuff like that. And I felt like the whole process of me trying to battle these negative thoughts were, okay, this has gone wrong, but something else is happening better. If I don't take these medications, I know I'm getting side effects, but would I rather have the side effect that I can cure that's not as bad as TB, or would I rather stop the TB medication, get worse, and eventually die anyway? I'd rather treat deadliest infectious disease inside of me than try and worry about the side effects right now, because I knew that there's always a way to treat the side effects, because side effects are from everything. You can take an ibuprofen tablet and you can have a side effect. It just depends on your body. And I just knew that any medication you take has side effects to it, and I knew that if I was taking such toxic medication, there were going to be side effects. And I trained myself to understand that you're going to feel horrible about these medications. Like, you had mood swings, I looked different, and I didn't like the way I looked. I didn't like the way I was losing all this weight, or anything, the way like I was having this sensation in my feet or whatever it was. I didn't like it, and I didn't know what to do with it. But I knew that I would rather get rid of the TB than not get rid of the TB and suffer side effects too, because I knew that I could get rid of the TB and then deal with the side effects, but I couldn't deal with the side effects if I still had the TB, because then I'd be struggling anyway.
Yeah, so your main focus was just to get rid of it, no matter what are the side effects, and then deal with side effects.
Yeah, I mean, I tell the doctors when I had a side effect, and there were always ways they helped to get rid of the side effects. So like when I had the sensations in my feet and stuff, they immediately took me off that medication. They were like, okay, it's damaging your nerves, let's take you off it. There was another medication that was causing another side effect, like my stomach problems, and we decided that, okay, let's stop that medication because that could be the cause of your pain. And there are ways, obviously, you feel like you're still being treated, and I appreciated that help, because as soon as I stopped the medication that was causing my side effects, my feet felt a lot better. Like, I wasn't in that constant pain. I'd rather be numbing my toes than feel that pain that I was feeling before.
So what are your next steps now? What
I know you
looks like?
I know you want me to say I'm gonna write a book.
I am not saying I want you to say it.
No, but I want to. I do want to. I would love to finish my master's in international public health and progress from that.
What are your masters about?
My master's is about, it's basically at the School of Tropical Medicine in Liverpool, and it's basically about tropical diseases in low-income countries around the world. So places like Africa, India, South Sudan, and places like that, where they don't have a lot of money. There's a lot of poverty, but the prevalence of disease is insane, and it's helping it's more talking about policies and how you can help people in low-income settings with the disease that they have to fight. So for example, like TB, malaria, HIV, AIDS, all of that, there's so many like chronic diseases that people in low-income settings have to deal with, and there's no way, sometimes there's no help for them. And so that's why I decided to study this and then branch out into tuberculosis, because that is a disease, internationally and in the UK. So kind of got the best of both worlds in that. So I'd like to finish that off and then branch off into that and basically work in the field of tuberculosis, really. My main focus is that now, helping people with TB. I am part of the WHO Civil Society Task Force for TB patients. We work as a group at the UKAPTB, where I'm an executive member of the committee, and you basically you're trying to get through to the Parliament about how to eradicate TB and give importance to TB that it needs. And obviously I'm making this catastrophic cost survey along with my supervisor and a team of people, where hopefully there will be a survey of people with TB to help with their costs and stuff, and then also write a book.
I can't wait to read it. I am willing to wait if needed. But
maybe once I finish my master's. Yeah, maybe once I finish my master's, I would definitely. Right now, I have quite a few opportunities right now. I'm quite busy with my master's, with all this work I'm doing on the side, like for all these different things. So I think once I finish my master's, I will probably have more time to focus on your side effects. Yeah, that too. See, I forgot again.
It's just like a norm.
My brain just literally ignores it. My brain
I
doesn't
think
like
like
thinking
every
about
time
it.
when we have a conversation, I always add to you like, oh, like, and don't forget that on the side you're still finding your side effects. Like,
Yeah.
it is
So my
nothing
brain
minor.
just, yeah, I think my brain just like completely wipes that bit out and is like, no, that's not happening. I think I'm so desperate to live a normal life that I try and in my head tell myself that you're living a normal life, but then obviously
Yeah,
I'm
well,
not.
in a way, you create that like illusion, not in a bad way,
Mm.
illusion that you are
Yeah,
having a normal life,
it's
but it
like I'm
doesn't mean
living
that
in
you
a
don't.
bubble.
Yeah,
Yeah,
then
I
it
live
is
in a big
actually a
bubble.
pretty good thing because it is a good thing because then you don't focus as much on the fact that you have TB slowing you down
Yeah,
or affecting you negatively. It still is affecting you, but you don't focus as much on the fact that, oh, I can't do this because of this. You still
yeah,
find ways. You probably fit it around TB's schedule, but you
yeah,
still find ways how to
yeah.
manage to still live and also add value to others and study and things
I
like
think
that.
I'm just trying to do the best I can out of a bad situation at the moment.
You think pretty well, I have to say. So.
Thank you.
And it's not just because of a friend. Yeah. Maybe there's anything else you want to add, or
I feel like we covered quite a lot and it was
not
quite
quite a lot.
interesting.
Yeah. Thank you for coming.
You're welcome. And I'm looking forward to the next podcast.
We will have another conversation when the book is ready.
That's
All right.
fine. You might be waiting a while, but that's fine.
Well, it's worth the wait. So,
Yeah.
all right. Thank you.
Thank you so much.